Welcome back, everyone, to a podcast to answer your questions on addiction, recovery, and mental health by Waismann Rapid Detox. I'm your co-host, Dwight Hurst. I'm joined today, as always, by Clare Waismann and David Livingston. Today, we have what triggered our discussion today is, David, you sent out an article. No, you didn't. Marina sent out an article. Claire sent out. Somebody sent out an article. With these group texts,
it's a new study that came from the CDC.
Yes, I need to figure out who sent what, but it doesn't matter. It is an article by Mike Stobe is the one who summarized this, but you're right. It's data from the CDC, and it's titled U.S. Overdose Deaths Topped 100,000 in 1 year, officials say. An estimated 100,000 Americans died of drug overdose in 1 year. Never before seen milestone that health officials say is tied to the COVID-19 pandemic and a more dangerous drug supply. I'm not going to read the whole thing. I just got into that paragraph.
I read the article.
Yeah. So let's dig into this. I know we've touched on this before. The obvious epidemic nature of this, but this is, for me, more than. I don't know if it's more than anticipated. I think by talking to you, Claire, I've learned to anticipate it going up. But what are your thoughts, your guys' thoughts about these numbers here?
Unfortunately, I saw this coming a long time ago. More unfortunately, I believe these numbers are low to what reality really is. The data is taken from, the data coming out of morgues. So, that's how they know how many people died. But I believe that there is a lot of people that died due to especially fentanyl in a number of different ways. There is also a lot of suicides that are overdoses. People really did not mean to die. So as horrible as this is, I think reality is much worse.
I think it is difficult because those things are always underreported. I mean, particularly because of the criminal nature of some use. If it's heroin use, people don't like to talk about it. And if they're good at hiding it, and they may or may not be, there are certain things that sometimes on reports people don't like to include the facts about that because of shame or embarrassment sometimes. And so I guess, I don't know the particulars of this study of where it all came from, but I think you're absolutely right. Whenever we have an indicator of something like this, it's almost always low, right?
Yeah, they say it is provisional, so this is not, the final data. And sadly enough, every time we see a final data is worse than, the original data provided to us because, they investigate more and more and they find more and more. Now, this was until April. Now, if you figure out the amount of fentanyl that has walked in to this country since April, and again, unfortunately, data does not show up for the first 6 months to a year.
Yeah,
I think we're going to see a tremendous higher number in the next year or so for the current time we're living
in. There's no doubt. I'm sure the numbers are much higher, as you're saying, Claire. And, just to put it in some perspective, when COVID was here, we shut down the whole country. Half the world shut down. Nobody went to work. Everyone wore masks. And there was a period where there were ultimately a lot more COVID deaths, but if you really look at, if you want to scale it to the impact of something like COVID compared to, well over 100,000 deaths in a year. And I can tell you from just talking to some people very, very recently who were taking, that people don't even know what they're getting in medicines anymore, and where they think they're doing this and then they find out that they're, and whether they're smoking it or they're inhaling it, they do a tiny bit and they're on the verge of dying and didn't even imagine that they were going to be in that level of jeopardy. So fentanyl is terrifying, and it's already wreaking unbelievable havoc. If there is ever a reason to get off of and stay away from, buying things and opioids off the street and so forth, it's, the danger is just profound.
What's some of the drive that increases the supply of fentanyl? Is it cheaper for dealers to get a hold of, easier to get a hold of? I mean, I know there's
all the above. So yeah, I'm sorry, all the above. So this is being manufactured